call. Now, the treatment helping snorers sleep like babies. As you're about to see, it's relatively pain-free and working for a growing number of people.
I wasn't sleeping as well as I could have, and I was pretty tired.
About 80% of all males over 40 snore.
Mine was going to a level that was unacceptable in the household.
It's not a pretty sound, but one that's all too familiar for thousands of Aussies. Even if you don't snore, chances are you know someone who does.
Snoring is immensely common. Intermittent snoring would be seen in at least 25% of the population.
Snoring occurs when the muscles at the back of the throat and upper airway begin to relax, causing a vibration as you breathe. While the action can not only disrupt sleep, it can also lead to a more serious form of sleep apnea, where a sufferer can stop breathing repeatedly throughout the night.
You wake up cranky and you're tired and you don't really know why.
When Bruce Egerty hit his mid-40s, the snoring began. At first, it was just occasionally, but as the years went on, his snoring became worse.
It sort of got to a point where I wasn't sleeping as well as I could have, and I was pretty tired.
It got so bad, he was forced to move into a spare room.
You start thinking long term. You start thinking, you know, is this the life we're going to lead?
That's when his wife encouraged him to seek professional help. It came in the form of a laser-based treatment known as SleepTight.
And you know, you're kind of skeptical of things, but I couldn't say no. I mean, I wasn't the one that was losing sleep. She was.
So far, we've done about 500 to 600 treatments. Now, what causes the
Dr. Cussell from the George Street Specialist Centre has been working with patients using the SleepTight program for more than a year to try and help snorers get a better night's sleep.
Our treatment doesn't pretend to treat severe sleep apnea. It's a treatment for mild to moderate sleep apnea, which is airway obstruction, and all forms of snoring.
The treatment involves a series of small procedures where a laser is used to target the soft palate in the back and the top of the mouth. Each procedure lasts around 20 minutes, where it's claimed the heat generated from the laser works to tighten the tissue and lift the soft palate to open up the airway and help promote the development of new collagen.
It's a very strong laser, but because it's not heating the surface, there's virtually no pain.
Today, he's performing a maintenance session on 35-year-old Peter Kumi.
You're quite comfortable, Pete?
It's not painful, it just gets warm sometimes.
He claims the treatment has helped not only his sleeping, but also general breathing.
It feels like you're more open at the back of your mouth and nothing restricting you anymore.
Peter's not the only patient claiming to have had success.
You know, I'm 46 now, so as you're getting older, you're more prone to snore louder.
Yeah, you've got the grill team. You've got
Breakfast radio host and former NRL star Mark Geyer knows all too well how disruptive snoring can be.
I go to bed about 8:30 at night. My wife comes to bed maybe 3 hours later, and she started to notice that as I was getting older, coinciding with the hours I was sleeping, that my snoring was getting a lot louder as well. She said, and such to a fact that you know, she said, babe, you're almost lifting the roof off the house.
Over the years, Mark says he tried other remedies, from aromatic baths to scented pillows, but nothing worked.
There was an old wives' tale about sleeping with a peg on your nose, until I saw a picture of it and thought, no, I can't do that. It was kind of making me panic, because I can only breathe out of one side of my nose because of many breaks in my rugby league career.
So when the clinic offered him a free treatment, he couldn't resist.
I went, oh man, as if you can stop snoring, it's impossible. Had a go of it, had 6 15-minute sessions, and without you know, BSing, I had almost immediate results.
While snoring is more common in men, women, although we may not like to admit it, can suffer too.
So the social implications of snoring are important. Marital disharmony is often reported in those who snore.
According to sleep expert Dr. John Sweeker, the issue of snoring isn't one to be taken lightly.
Snoring is often simply something that's laughed off as being a cosmetic issue, but in some people it turns into a serious health issue.
This new type of laser treatment doesn't come cheap at $1,000 a session, and you may also need regular maintenance.
On average, most people are going to have a maintenance treatment once a year.
but there are cheaper options available. Some popular methods include nasal strips from around $1 a night, sleep positioners such as Night Shift, which cost around $350, and mouth guards, which can cost several $100s when ordered correctly from the dentist. And for more serious sufferers, there's also CPAP masks, which can start from around $250. Often it can just be the position in which you sleep that's causing the problem. Focusing on your overall health, though, is also important, and cutting down on alcohol and watching your weight can help. While Bruce and Mark claim to have had success, not all treatments are successful or suitable for everyone.
Anything that injures the soft palate can potentially scar it, and over a period of weeks can stiffen the palate so it makes less noise. But it often doesn't help with the breathing during sleep, and so therefore sleep apnea can still occur, even in the absence of much noise.
Your partner's happy and you have a beautiful 8-hour sleep, well, your whole day changes.
Well, I know what my wife will be saying when I walk in the door tonight, and you'll find more information on that treatment at our website. Now, here's a nice little